facelift procedure is a rejuvenating procedure that helps re-elevate the middle of the face and the lower part of the face, or the neck area. Patients come to see me because they're starting to see some signs of aging, and that's usually the symptoms are deepening of the folds around the mouth. Sometimes we're getting some lines here, or what we call marionette lines. We're starting to see some jowling, which is the fullness of the tissue right behind those lines. They can start to see now some neck laxity. The skin is losing some of its elasticity. And these are all signs that are normal signs of aging. So when I assess the patient, I really kind of take a look at how much laxity of the neck versus the mid-face or the middle part of the face. As we get older, those usually age in synchrony. But sometimes you can have early on more signs of aging just in the neck area, so you can undergo a neck lift by itself. But as we get a little bit older, that the mid-face starts to come down, and so it's not good to just do the neck lift, because you want to balance everything. You want to pull the skin and the soft tissue back up on the face as you would in the neck. So the incisions are usually right around the ear. You can kind of move in and out to kind of snake it around the ear here. Then it goes behind the ear, right in the ear crease, up to the upper part of the ear, and then over into the hairline. So the incisions can be pretty well camouflaged or hidden from sight. The surgery takes about 2.5 to 3 hours. It's for me, under IV sedation. Sometimes patients will need general anesthesia, but I let the anesthesiologist decide what's best for the patient. It's an outpatient procedure, so you're usually in the recovery room for about an hour and a half. Patients will go home with a head wrap on, so it's just some light gauze around the face and around the forehead. That stays on for 24 hours. Patient comes back to see us in the office the following day. We take that off and push you into a removable compression device. The patient can shower and shampoo their hair the following day. I don't let patients color their hair for about 2 weeks. Now, getting you back to work, most patients, depending upon your job, can go back to work usually in about 10 to 12 days. Sometimes if you're in a very active job, it might be 2 to 3 weeks. I don't let anybody exercise for 3 weeks, and no housework at all for about 3 weeks.